Hi, my name is Julie and I'm a specialist physiotherapist for the Respiratory Pulmonary Rehabilitation team. This education session is about managing breathlessness. Understanding breathlessness is incredibly important when you're living with a lung problem. The fear of breathlessness for some of you is really quite intense, isn't it? When breathlessness becomes too severe and it feels like you can't get your breath back, it's incredibly frightening. And unfortunately, those memories of feeling so frightened when you haven't been able to get your breath stay with you. That leads you to quite naturally want to avoid getting out of breath. And avoiding getting out of breath means you don't do as much. You're not as active. Now, when you're not as active, unfortunately, that means that your muscles become quite weak. And guess what? Weak muscles, those cause more breathlessness. So you often get stuck in this spiral of not being able to move around as much or do the jobs or activities that you normally do because they make you feel so uncomfortably out of breath that then you don't do them, and then unfortunately your body becomes weak, deconditioned, and then you don't ever do them, and life can become really quite tough for you, can't it? So I think that if I could help you to understand what's going on in your lungs and give you techniques that may be able to help you recover from the breathlessness, give you a sense of control back, this may help. And you may find that you don't avoid activities that you may previously have done. We may actually be able to help you get a little bit fitter too. So essentially, it can actually make you feel less breathless. So let's start with understanding about breathlessness. So when you suffer from a lung problem such as COPD, chronic obstructive pulmonary disease, the problem with the lung disease is that if you imagine your lungs, okay, you have your windpipe that comes down here and then you have two tubes that come out, okay, and it goes to your two lungs. Now, the tubes are basically going to lots and lots of more tubes that come out and then eventually comes out to some air sacs. Now, the damage, okay, is in two places potentially. It's in the tubes, as in the tubes become narrow. Now imagine when you breathe through narrow tubes, that's hard for you. Not only hard for you to breathe in, but also very much harder for you to breathe out. It takes you longer to breathe out. This is often what causes as part of the problem. The next problem is that the air sacs lose their elasticity, so they aren't able to, they can expand but they don't come back down to their normal position. And that also can lead to changing in the shape of your lungs and pushes down on structures of your lungs, and this also causes breathlessness. The reason why I explain this to you is because often you feel like your breathlessness is actually caused by a lack of oxygen. Yeah, you feel like you can't quite get the oxygen in, when in actual fact this is more about air not being able to come in and out of your lungs and being trapped in your lungs. So this leads me to teaching you a technique that can help with that. Okay, you'll hear me talk about something called blow as you go. Blow as you go encourages you to breathe out as you're moving. Because if we think about those narrow tubes, if it takes you longer to breathe out, okay, that will help you give a little bit more time to breathe out, and then there's space for you to breathe in again. Unfortunately, if you're breathing very fast and you don't allow that time for the air to come out, then the lungs become too big, too inflated, and you've got nowhere to breathe. You've got nowhere to breathe in, and that's when it hits you and it becomes incredibly frightening because you can't breathe. So breathing out. I always talk about, if in doubt, breathe out. It's all about breathing out. You don't have to push it out too far, but just think about lengthening the out breath. Blow as you go. The other thing you can do is positioning. So if we think that the air can get trapped down in the bottom of your lungs, you can find that you can try some positions. And we'll show you some photos of some good positions. But very simply, and you will have already have adopted this position, leaning forwards gently on your elbows, relaxed hands. Okay, it's really important that these forearms stay relaxed. You're leaning through your shoulders. This enables your rib cage and your diaphragm to move more easily. You'll have felt this when you've been out of breath. You'll have probably automatically leant forward. So this is something that we also talk about. I think one of the most important things with managing breathlessness is having some control. You have to remember that you have more control over this breathlessness than I think you feel like you do. If you were to move around, okay, and become breathless, you know that at any point you can stop, and within a minute or 2 minutes you can get your breath back, yeah? And I think remembering that when you stop, give yourself a couple of minutes and the breathing will come back, okay? That's important to remember. Now, I always tell patients that you don't need to push yourself to the point where you're so out of breath that you cannot even say one word. That's just a place, it's not necessarily bad for you. It's just a place where it takes longer to recover and you get those fearful memories. I want you to create memories in your head of feeling in control of breathlessness. So that's where you will be breathing deeply and fast, but you can still say 1 or 2 words between each breath. And if that breathing becomes more than that, then pull back, stop, pace yourself. Pacing is really important, slowing down. I think in our heads we all feel like we're 21, don't we? But unfortunately our lungs can't quite keep up with our brains. So slowing down is important, and that's hard for some of us, isn't it? Those memories that I talk about, those negative memories, they are important too. Those negative memories, unfortunately, will contribute to the breathlessness. They will make you avoid getting out of breath. They will also make you feel anxious, okay? Anxiety, living with a lung problem makes you feel anxious, doesn't it? I mean, having to deal with all your medications, your doctor's appointments. This is a chronic illness. This is a chronic illness that's going to be with you. You don't know when the next chest infection is going to happen. It will cause anxiety in itself. Now, when you feel anxious, this can actually change your breathing pattern. And this can also contribute to your breathlessness. So although I've been previously talking about breathlessness when you're moving around and how to, one of the things I talk about is stop, drop, flop. So stopping and coming forwards and flopping into that leaning forward position, taking control. It's also about understanding how to breathe, or a good breathing technique when you're sat still at rest, because I think often we don't think about breathlessness when we're sat still. We kind of just presume that we breathe very well when we sit still, but I think a lot of us don't actually breathe that well. You wouldn't even notice it. So let's just have a look at that now and think, well, how should I breathe when I'm sat still? Because if you can't breathe well when you're sat still, how do we expect you to breathe very well when you're moving around? We've got to go back to basics here. So have a go with me now. First of all, place one hand on your upper chest and one hand on your tummy. Okay. The first check is to see whether you're breathing through your nose or your mouth. If you're breathing through your nose, perfect. Your nose warms the air that goes into your lungs. It cleans the air that goes into your lungs. It moistens the air that goes into your lungs. It is so important to breathe through your nose. Remember, I'm only talking about when you're sat still at the moment, okay? It also helps your diaphragm to work. Your diaphragm is this muscle down here. This is where this bottom hand is, to feel whether that diaphragm, which is a strong muscle, a bit like your heart, is really important for your breathing. But it can often switch off in times of stress, or can change position when you're living with a chronic lung problem. So we'll come to that. It will be much easier for you to open your mouth, wouldn't it? Because it's a bigger hole compared to your nostrils, which are much smaller, harder to breathe in. But remember, we're talking about when you're sat still or lying down, when you're still. We're not talking about when you're moving around. Okay, so back to here. I want you to see what moves when you breathe, okay? What I'm looking for, ideally, is for your tummy to just come out a little bit as you breathe in and come back down again as you breathe out. And for the majority of the time, this area to be nice and relaxed, okay? So you breathe in, your tummy rises, you breathe out, it falls. And then there's a short pause before the next breath comes in. Now, some of you might be sitting here thinking, oh gosh, I've got too much going on in my upper chest. Now, the problem with that is that you will be using muscles in your neck and your shoulders that use up a lot of energy. They're a bit like your biceps, and they're not really designed to be working all day long. So if I was to do this with my bicep all day long, it would be sore at the end of the day. It's the same with these muscles. They're not designed to be moving all day long. They're great for when you need to move around. They're not designed for when you're sat still, okay? So if you can, and it can be quite challenging when you first sort of look at your breathing patterns. Often when you talk about breathing, you just want to breathe more, don't you? Well, just try and relax into it. And you may find you need to go away and have a lie down, play some music that you like, and just think about placing your hands down on your tummy here. So that's over the diaphragm area. Closing your mouth and gently breathing in and breathing out. And then imagining your lungs are in your tummy, okay? And it can be incredibly relaxing. And you might find that this will just start to relax off a little bit. If you're doing this and you're thinking, oh gosh, no, I can't do it. I just can't do it. There may be a reason why, okay? In some people with more severe lung disease, often the air sacs have become quite enlarged, okay, where you've lost that nice elasticity. So it pushes down on the diaphragm, puts it in a different position, in a flattened position. So that's why you guys would probably find that if you came forward into this leaning forward position, keep your hands relaxed, you might find that you can feel the diaphragm working more easily in this position. And if that's the case, this is the position that I want you to practice this breathing technique in. Imagining your ribs coming out to the side. You can't place your hands. When you're here, imagine your ribs. You can sort of put your hands down, maybe at the sides there, okay, if it's easier. Okay, breathing in and out through your nose. If you practice this, it only needs to be for a minute or so. Don't have to practice it for too long. Throughout the day, when you're sitting relaxed, that can really help with your breathlessness when you're moving around. So then as you get up and move around, initially you might want to just prepare your body for movement. So if you know, okay, I'm going to pop upstairs and grab something from upstairs, then take a nice big deep breath, open up the lungs, you know, give it a chance to get working, okay? And then you'll stand up, okay? And then you'll start moving around and you'll notice your breathing will become more deeper and faster. So initially then you might try breathing into the nose, out through the mouth. And you can try that pursed-lip breathing, whatever you adopt, that, but trying to breathe into the nose, breathing out through the mouth as you're moving around can really help you. You may get to the stage where you are just getting the air in and out through your mouth if you're working hard, especially with the exercises that we love you to do. And that will be fine for when you stop. You're going to then, as you start your breathing to come down more naturally, you then come back to in through the nose, out through the mouth, in through the nose, out through the mouth. And this will be working as you're moving around. But then you might find you stop, drop, flop, you breathe out, in through the nose, out through the mouth, and within a minute or two you're recovering, okay? And you're going to tell yourself you're recovering and you are in control, rather than, oh my gosh, I don't know when I'm going to be able to, I don't know what, you know, and all those negative, scary thoughts going through your head. Take control of this. And you will find within a few minutes you've actually recovered from this breathlessness. And this can be the key to managing breathlessness. Understanding that getting out of breath is actually really good for you can open up your world. Now you notice I haven't actually mentioned about inhalers. Inhalers are incredibly important for managing breathlessness. Those ones that you take daily, regularly, whether it's twice a day or once a day, you always take. They will be contributing to your managing your breathlessness. And for some of you, you may carry a rescue medication around, such as Ventolin, salbutamol, your little blue inhaler. So that's important to have with you at all times, I must say. And it's important for that time where these techniques that I've taught you today, blow as you go, stop, drop, flop, if in doubt, breathe out, and that forward leaning position. If those techniques do not help you, then that's the time to take your Ventolin to help you recover from the breathlessness. Or you may find you use more Ventolin to help with breathlessness when you have a flare-up, what we call an exacerbation. If you're interested in knowing more about inhalers, we've got some education sessions on inhalers and also on exercise, on all sorts of subjects. So please do go and look at all our other education sessions. They can be really helpful for you. I would like to just now take this opportunity to thank you for listening to this education session, and I wish you all well, take care and control that breathlessness.